Yes. Good. Hi, everybody. We're presenting hidden populations as, in particular, a focus on older adults, those who are critically ill and experiencing communication impairment. Okay, I'm having a little oh, there we go. And we come to you from the Center for Healthy Aging, Self-Management, and Complex Care in the College of Nursing. Faculty in our center conduct research with older adults in a variety of areas. My area of expertise is in critical care, and in particular in communication disability. So one of the questions that we're asking you to consider is communication disability an exclusion criteria in your research? And what I mean specifically is vision and visual acuity. So our patients, if potential participants aren't able to read consent forms, or tools, measurement tools, are they then excluded? The same question, it applies to hearing impairment and the ability to speak in a way that's understandable to the research team. Dr. Rose will talk about altered mental status or cognition, and we want to consider as well the inability to speak in a language that's understandable to the research team. So all of these are aspects of communication disability or impairment. And so for my patients of interest in my research, those who are hospitalized, all of these factors come into play. We certainly have a portion who are non-English speaking. In our research in the intensive care unit with mechanically ventilated patients, we found that over 80% had vision impairment. And of those who were vision impaired, half did not have their glasses available at the bedside, and 10% were hearing impaired, and most did not have aids, hearing aids available. So what solutions do we have? Well, we're recommending using universal design for research approaches, and we've provided some really good references and recommendations for universal design. We use and recommend in my research, and for research with a population that you anticipate having some communication disability, using a structured communication assessment and intervention framework. By intervention, I mean particular accommodations for a communication disability. And so these are simple augmentative and alternative communication tools and techniques. And certainly, while this isn't rocket science, it doesn't come naturally or isn't part of our usual training in human subjects research. And so some additional training in how to both assess and apply some communication accommodations are needed. And we have that kind of a program as part of our research and available on our College of Nursing website, which we'll get to in a minute. So in our study of patient-nurse effectiveness with assistive communication strategies called the SPEACS study, we devised a multi-component intervention that included specialized training for nurses, and this was done in collaboration with communication disorder science, a speech language pathologist who really helped develop the training, and the communication supplies. And we've used this same training and these supplies in other research to best engage hospitalized patients and patients in the intensive care unit in our work. So in this SPEACS study, 72% of those enrolled could fully participate in the consent. Now, because they were patients in the ICU, we also had families present and the opportunity to engage surrogate decision makers, but we were able to use these tools and techniques to both communicate to the patient in a way that they could understand about this minimal risk study, and to ascertain their understanding and agreement to participate in the study. Not all could sign the consent forms. They didn't all have good use of their hands or the dexterity and coordination to sign, but that's why we engaged families as well. And most important, of course, in informed consent is the understanding and agreement. So using these same kinds of techniques in an ethnographic study about care and communication with patients weaning from prolonged mechanical ventilation in a medical and step-down ICU, we were able to conduct brief patient interviews during the period of mechanical ventilation, usually interviews with patients about their experience of mechanical ventilation is done only on survivors and only after they are no longer on mechanical ventilation. There are a couple limitations to that, limitations in terms of recall, as well as distance from the event and changes in how the event is perceived. So we were really interested in the moment experience and perceptions of the patients, and we're able to do that for 18 out of 30 patients using these techniques. In another study that I participated as co-investigator in, this was a study of palliative care for hospitalized patients with advanced cancer. It was an NCI, National Cancer Institute funded multi-site study. And a collaborator and I were leading the University of Pittsburgh site, where we enrolled over 1,200 patients and family caregivers across 3 UPMC hospitals. But we noticed as we were, we kept meticulous records about admissions of patients with advanced cancer to any one of these acute care hospitals. And as you can imagine, the eligibility criteria for what constituted an advanced cancer was very specific. But we noticed that we were missing opportunities with those patients who had head and neck cancer and those patients who required mechanical ventilation during their hospital stay. And so we trained research staff in all 5 centers to use these same communication accommodation techniques. And so we were able to increase enrollment and participation by 6% after we used these techniques. My current or most recent study has been to, again, in the intensive care unit, study of the use of a patient communication application, a tablet app that we've been involved in development and iterative testing. And so both in this study and in others conducted in the intensive care unit, these are the patient eligibility criteria, we've done a lot of groundwork with stakeholders in the ICU. This kind of work requires screening and recruitment on days and evenings. Oftentimes, family surrogate decision makers need to be involved. And so revisiting the unit frequently for when either patients are able to be approached or patients and family caregivers are able to be approached is really important. And so we've also been successful in engaging the critical care research coordinators in that work, and it's been invaluable. The other tip that I would give is in rounding with the ICU team to not only have them understand and be comfortable with your study and the purpose of your study and the eligibility criteria of your study, but also to help identify patients who could be eligible and might be missed in a screen. So it's kind of a validity check of your screen and screening processes. So here are our tips for accommodating communication impairment in research. First, using an established yes/no response with the patient. So you may be able to change or adjust some surveys or measurement tools to yes or no. And multiple choice are yes, no options if you read each choice, right? So establishing a clear yes, no response, which may be head nods, but maybe something else if the patient is not able to reliably use head nods. And so like thumb up, thumb in fist, or eyes up, eyes shut tight. Certainly providing hearing aids or hearing amplifiers. There are a variety of choices there. Facing the patient, locking eyes, speaking slowly and allowing a pause time. For patients who are suddenly without voice, as in the intensive care unit, they really need to think about how they're going to answer a question. And so that lag time isn't necessarily indicating that they don't understand. It's just indicating that they need an extra moment to formulate their response. So always we recommend screening for delirium, and there are and cognition, and there are tools like the cognitive assessment method for the ICU that does not require a vocal response. using large print for accommodating visual acuity challenges, as well as response cards for pointing to responses with patients who aren't able to speak. So we would read the survey questions to the patient and then provide the Likert scale and allow them to select and confirm their response. Our training is available at go.osu.edu/speaks, and would also really recommend the resources of the full inclusion of persons with disabilities in research, the FIND lab at Case Western Reserve University, and we provide the link there to the FIND lab and the FIND lab resources. They, as an aside, entered into a collaboration with Cleveland Sight Center and Cleveland Hearing and Speech Center to develop an iPad app that allows researchers to load any research survey tool into a program and produces a universal designed survey. So these can be used with research participants who are blind or deaf in this iPad format. So we recommend that to you, as well as the resources on this page. Thanks so much. And we're